Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a weekly series airing every Friday. This is a space for opinions where we talk about current events and questions the Latino community is curious about. Today, we are joined by Commissioner Chris Nicolopoulos of the New Hampshire Insurance Department. Appointed in February 2020, Chris is serving his first term as commissioner. Welcome, Chris. It's a pleasure to have you. Thank you for joining us this week.
Thanks for having me, Belen. Happy to be here.
It's a pleasure, yes. I was hoping if we could start off, if you could give us an introduction to the State Insurance Department, its mission, and its different types of work.
Sure. The mission of the New Hampshire Insurance Department is to promote and protect the public good by ensuring the existence of a safe and competitive insurance marketplace through the development and enforcement of insurance laws for the state of New Hampshire. What that really looks like is we have a number of divisions here that regulate all aspects of insurance. One of our number one divisions is our Consumer Services Division. And in a given year, they'll take 5,000 consumer inquiries in and help consumers with simple insurance questions or more complex complaints. We also have departments that review the financial and regulatory filings of insurance companies, primarily to make sure that they're going to have sufficient assets to pay claims and to remain in business. And part of that is ensuring that they're charging appropriate premium for the risk they're taking on. And then ultimately, we have people who make sure that companies are conducting themselves in compliance with our laws, making sure that they're either not discriminating against any class of people, are making their products equally available, and are administering claims in a fair and equitable way as well.
Thank you for that. That was a great description. So most of state departments have been greatly impacted by the COVID-19 pandemic. I'd like to talk to you about how it's impacted the insurance division throughout 2020.
Yeah, so it's been interesting because I started as insurance commissioner about 10 days before the state closed down. So I was nominated and approved here in New Hampshire. I started on my first day, and just a week and a half later, we sent everybody home. So the department here has 75 full-time staff members that do all the things that I mentioned before. And once we decided it was safer to have people home, what was critical is to ensure that we were able to continue delivering those key consumer protection services. And over the last year, we've maintained at least half of our staff at home and using technology, laptop computers, and a dedicated team, we've been able to ensure that we've continued to deliver all of our core functions. We're starting to get to the point now where more and more staff are welcome back into the office. So we're transitioning back, but I think we were very lucky to have the resources necessary to support our staff during this last 12 months.
Absolutely, yeah. Sort of creative solutions and adaptation is really the theme of 2020. It seems like it. I'm wondering, what are the department's current priorities as we gradually are recovering from the ongoing COVID-19 crisis?
I think the department generally is concerned that the marketplace continues to operate in a fair and equitable way, and that there's access to a vibrant insurance marketplace. Consumers should have and hopefully do have a lot of opportunities for companies who want their business, be it car insurance or house insurance or business or health. And by having a number of companies competing for consumers, we tend to see more competitive pricing. Given that we're still coming out of the pandemic, a number of our issues are educating consumers about the resources that are available to them, making sure that they're aware that they have access to COVID-specific coverages under the health insurance, or that businesses understand what coverages they might have related to the ongoing pandemic.
That's important, right? Absolutely, that sort of relationship with community and outreach and offering resources. We'll definitely be getting more into different resources. I was hoping if we could jump into, you could tell us about how New Hampshire coverage of the COVID-19 vaccine, how that's coming out since it's being rolled out now. What should residents know while looking to schedule their vaccines?
Well, I think New Hampshire's doing a phenomenal job of getting the vaccines rolled out. And as of today, anybody over the age of 30 is now eligible to get a vaccine. The state has the Winnie website where people schedule their initial appointment or their second appointment. And I think the number one thing for residents of New Hampshire to know is you don't need insurance coverage to get a vaccine. And if you do have insurance coverage, your insurance carrier would pay for the cost of both the administration of the vaccine. There is no cost for the vaccine. The government's paying for that. But there is no out-of-pocket expense for residents of New Hampshire to obtain a vaccine.
Thank you for that. That's important information. For residents without insurance, is there a specific process or is there a specific place they go to, see when they can have their vaccine, make an appointment?
That's a great question because the process is absolutely the same for with or without insurance. You go to the website. So if you literally search in Google, New Hampshire COVID vaccine registration, it will bring you to the website at DHHS, and you fill it out, some biographical information, your name, your date of birth, where you live. It will ask you if you have health insurance or not. You can skip that question. If you have it, you put it in. But if you skip that question, you go to the same scheduling window. And so the only prohibition against scheduling your first appointment is age at this point. And as I said, it's 30 and above today. And as of Friday of this week, it'll be 16 and above. And so anybody who's over the age of 16 as of Friday will be able to schedule an appointment. I understand some 30,000 New Hampshire residents scheduled an appointment this morning, and there's nearly 100,000 available appointments right now.
Wow, that's a really quick process. Yeah, we're seeing how quickly this is going to really help the state in a number of ways, sort of going back to normal as we hope.
I think people are dying for that. They really are ready after a year to have some semblance of what we remember being normal.
Right, absolutely. Jumping again, I was hoping we could hear your thoughts on the American Rescue Plan, which right now is really pretty popular on people's minds, I'd say. And we were hoping if you could just talk a bit about its different benefits.
This is a great topic for us to discuss because there are a number of issues that will affect a lot of New Hampshire residents. So President Biden signed this order just a few weeks ago, and what it does, number one, is it creates a special enrollment period for getting into the individual marketplace. Typically, you have to enroll for individual health coverage in the marketplace before December in the fall. But he's opened up a special enrollment period that basically will go from now through August 15th. So people who want access to the marketplace to get health insurance can get it. And so that window is new and different and is wonderful because it allows people who didn't opt to get coverage earlier to get it. But it does a number of other things. It also increases the income limits by which a consumer would get subsidies. And that could be, subsidies could be one of two things. It could be premium subsidies, meaning the health insurance that you elect is cheaper per month. And in some cases, it could also be a subsidy for your cost share or copays. And by increasing the income limits that qualify you for those subsidies, you're making it more available to folks. But also, it's important for folks to know if you're already in an individual market plan and you were near a subsidy level, it may make sense to go back in during this special enrollment period and apply again, update your income information, and see what plans are available because you may benefit from some pretty drastic reductions in cost.
Thank you for that. Where could residents go to learn more or apply?
So healthcare.gov is where they should go. When you go to healthcare.gov, it will ask you, what state are you in? Questions about again, demographic questions about you. Then you can look at plans that are available based on your projected income for the year. And so those subsidies are based on what you project your total income will be for 2021. And then it will create a premium based on that. And as the year progresses, because we're only a third of the way through, a little less than a third of the way through, you can update that if you found that, I'm earning more or less based on my projection, and your subsidy may change.
Okay, thank you for that. That was a lot of great information. It's very important to share. As you mentioned earlier, you started your first term as commissioner during an incredibly unusual and unique time right away. I'd like to hear about your main goals for the department throughout this term, the next few years coming up.
Thank you for asking that question. I think whatever goals I would have said a year ago pre-pandemic went out the window. I think I'm proudest of the work we do here for consumers. And whether it be just providing them information about an insurance issue that they have so that they better understand the forms or the products that they own, or if we're able to help them navigate through sometimes a difficult process of a dispute with their insurance company. I think it's also critical for a regulator to understand that that we need to have working relationships with not only the consumers and not only the licensees who sell insurance products, but the companies. And in furthering building those relationships, my team, my senior health team, meets with each of the commercial carriers every other week to talk about emerging COVID issues, emerging marketplace issues. When we have complaints, we are able to talk to them. So I've kept the dialogue open with them. And I think that's helped us work as a team through a pretty difficult time. And so I hope to continue that. And finally, I think it's important that the 75 staff members here who are committed to insurance regulatory work understand that we are here to support the industry and all of our constituencies, and that we're accountable for our work. And we've got a phenomenal staff here.
Thank you for sharing that. How could residents get in touch with your office, stay updated with the department's work moving forward?
Sure. Our office, so probably the best place to reach us is nh.gov/insurance, because all of our resources are there. Telephone numbers, directories, our consumer portal, a ton of information about different insurance products, information about vaccine copays or COVID testing information, that whether or not there's copays associated with that. All of that support information is there, but also the contacts for our different divisions. So that's probably the place.
Perfect. Thank you so much. And then right before we go, are there any other updates, news, or reminders that you'd like to share with our audience?
I think it's always important to, when you're looking at insurance products, to realize it is a competitive marketplace. There are experts out there to help you, insurance agents. And if something seems too good to be true, or you're questioning whether or not you're being told the right information, use the resources at the New Hampshire Insurance Department. Call our consumer division and check with us. We can help explain to you whether or not the person trying to sell you a product is licensed here in the state, whether or not they're licensed to sell. It's easier to give you that advice before you get into something that isn't what you intended. And I think leveraging our resources here could be helpful to your membership.
Very well said. Thank you so much. Yeah, a great message for everyone. You're the expert, so why not? So thank you so much for talking with us, lending us your time and expertise, Chris Nicolopoulos, and for being our guest this week for NHLN Opinion Plus.
Thank you, Bailey. Have a great day.
Thank you, you too. Take care. Everyone, please tune in next week for another episode. You can follow us on Twitter at NH Latino News and Instagram at NH_Latino News. I'm Belen Dumont with NHLN Opinion Plus, and I will see you all next time.